Welcome to the I Told You So podcast. I'm your host, Dr. Ben Kohl. I started this podcast because I noticed an erosion of societal discourse and how normal conversations are often fueled by polarization. The I Told You So podcast offers an opportunity for healthy discourse and effective debate. I select topics to discuss and debate with listeners and guests of the I Told You So podcast. Listeners and guests predict what will happen in the future. I track predictions and announce who predicted accurately when those predictions become true. The podcast offers topics where listeners and guests can discuss and debate with the goal of predicting the future so they can proudly say, I told you so. My guest for this episode is Sarah Siders. Sarah Siders is a mental health therapist and coach with over 15 years of experience in the field, as well as a background in local and international nonprofit leadership and journalism, and a brief and eye-opening stint in politics. Sarah has recently opened a mental health practice in an integrative wellness center and focused on supporting women across the life stages, from parenting in the early childhood years to navigating midlife changes. Sarah's approach is trauma-informed with a focus on mind-body integration. Sarah and her family have lived in Manhattan for over 20 years. That's Manhattan, Kansas. She has 2 boys, and she's into hiking and outdoor adventures in the mountains or at the ocean, which are both far away from Kansas, and she is, I think, quietly reading a good book most days. So, on this episode, Sarah and I discuss the future of mental health. So, Sarah, thanks so much for being a guest on the I Told You So podcast. Let me start our conversation by asking you, well, let me start with this. You've recently reopened your therapy practice, but you've had several other roles over the last couple of decades. So, what led you back into therapy now?
Well, thanks for having me first, Ben. It's fun to be here. And I usually don't say I told you so out loud, but it'll be fun when I get to do that. So thank you so much for the opportunity. So the process of being a therapist is, something it's really kind of a life journey. And I started that when I got done with my master's about 15 years ago. And I thought I was going to go straight into clinical work and do that for the rest of my life. But you know how, interesting stories typically have pivots and turns that we don't expect.
Oh, yeah.
And so, my background's in social work, and I think that I always felt like there would be some opportunities for working in the nonprofit space, using my journalism, a little bit of a journalism background. And I always had a little bit of an interest in politics, but I wasn't sure what that would look like. And so when I opened my own therapy practice about 7 years ago, what I found was that I was pulled into the entrepreneurship space. And I was really surprised by that. I thought, well, I'm a therapist, but as I got into it, I was like, well, I'm a business owner. And I started really resonating and connecting with entrepreneurs. And within 18 months of starting my practice here, I had a small group of people from the business community saying, hey, we need a young professional to run for city commission. And so I realized that, there was a storytelling element to a political campaign, which, pulled in on my journalism side. There was an advocacy side of advocating for business owners, advocating for people who needed their voices heard as a political candidate. And that pulled on my social work side. And so a lot of parts of myself that maybe felt disparate were kind of lining up in that identity as a political candidate and advocate. And so I ran a great campaign, and we didn't win, but the mission of advocating for business continued as I helped launch the nonprofit Spark in Manhattan, which I ran for 3.5 years as the director. And that was a really wonderful opportunity to bring together some of the storytelling, the journalism side, the nonprofit advocacy side. And wouldn't you believe it, sometimes sitting down with entrepreneurs in a group setting or one-on-one, there is a little bit of that, hearing someone's story and helping them feel validated or supported, that reminded me of being a therapist. And so I think sometimes we have these core threads in our lives that show up across our roles, and the different things that we do. And it kind of shows us who we are. And so it wasn't really that big of a stretch for me to come back to therapy. But what's exciting about it is so many of the changes that have happened over the last 5 years. When I closed my practice 3 years ago, and I thought, I probably won't come back. What has changed over the last 3 years, which we'll talk about here, that kind of points toward the future, is really compelling and part of why I wanted to jump back into the field right now.
So yeah, you mentioned change. So what has changed in the field of mental health in the last few years that you see being an indicator of the future of the field?
Well, when I was getting ready to, for this podcast and thinking about some of the things that we could discuss that would just, be interesting, I actually thought, okay, AI and technology are really big for, we're trying to figure out how to utilize AI tools and AI personas in the mental health space. Are they going to be a good therapist? Probably not, but can they help with diagnosis or kind of triage and that initial assessment? Yeah, definitely. And so I thought, well, let's go ahead and see what ChatGPT can do. If I give it some notes and, can it help me come up with some thoughtful questions for this conversation? And so I did. I put that in there, and I, let it know what my role was, and that I was going to be on this podcast about, the future, discussing the future of mental health. And it gave me some good notes. And so I put some of those into our conversation today. And just the fact that I can do that, when 3 years ago, when I closed my practice, ChatGPT was not something that we were using. We weren't talking about it. We didn't know how much it would change our lives. And so now being able to generate some questions, or just get a starting point maybe for a blog article, or to understand some common, when I was thinking about how to communicate with my target clients for women in early childhood through midlife, thinking about some of the challenges that they have, or some of the online or physical spaces that they're in. I was able to generate some of that from ChatGPT. So from a business standpoint, from getting to know a client, whatever type of business you're in, AI is definitely a tool, and can be a tool for, again, kind of triage or assessment. I think the part that we're not going to see take hold, I am risking a little bit of my reputation here, because maybe I won't be able to say I told you so, but I really don't think that, the human brain is wired for connection, and it's wired for that kind of like mutual burst of oxytocin, which has been called by a TED Talk speaker the moral molecule. It means that, like, you have oxytocin, I have oxytocin connection, as we're sort of on the same frequency and we're connecting with each other, and it makes us like each other. And when I like you, I'm less likely to do something harmful to you. I'm less likely to want to come to your house and, like, slash your tires or say something mean about you in public. I'm going to maybe defend you, or I'm going to maybe refer you for, a professional reference or something like that, right? Because we have positive dynamics. And so a robot can't really give us that, mutual sense of connection that human beings really want, especially when we're wanting to feel validated and heard. I think it can do that a little bit. But yeah, AI really is going to struggle to be a human. And I think it's like trying to acknowledge its own limitations in that space. So I'm really good. I'm seeing some limitations there, but something that's within the technology space that's also new. When I left my practice 3 years ago, we were just getting started with COVID. We were about 1 year in, and I remember that right when everything shut down in 2020, we were having these in-person sessions, and there was a ton of regulation around the type of telehealth portals that could be used. Everything had to be encrypted end to end. And so all of a sudden, they said, okay, we don't have any regulations for that type of encryption. If you need to be doing a therapy session via Facebook Messenger video, you go right ahead. We were on Zoom, we were on Google Meet. I mean, it was like FaceTime. It was crazy. It was the Wild West. And so since then, telehealth has become a legitimate way to provide care. It's not just like second best. It's actually a very, very helpful way to provide access to care to people who are in hard to reach places, like a rural situation, or maybe a deployment environment for veterans and active duty military. There's so many ways that we can help give access to people, for mental health care in a way that we couldn't do before. And it's seen as legitimate. Whereas before it was like, a video call felt sort of second rate. But now here we are having this conversation on a video call, right? Just like I might have for therapy. And so it's really the change during COVID that forced us to communicate virtually actually legitimize the platform in a way of like, meeting people and providing care. So we have AI here, which it really needs to learn its place, which it's doing. But then we have telehealth where it's like, well, I can't be with you in person, but I can be with you virtually. And so it's not like, it's not as detached as AI, but it definitely provides that human connection and the ability to provide an actual treatment modality as opposed to, something that's kind of like a large language model. It sort of learned how to guess what a therapist might say, but it's not actually a therapist. That's super scary to me to have a robot trying to guess based on previous conversations. We need human intuition in the fields a lot. So those would be a couple of the really big ones. And so I'm curious if you have any thoughts on those. There's one other one for the future that's not tech related that I'll mention, but if you had any thoughts on that, or if you want to duke it out on whether or not you think AI is going to take over and be our therapist, I'm happy to hear your thoughts on that.
No, what I kind of find maybe a little bit ironic is that I'm looking at these companies creating these robots, and they're creating them to look like us. And I'm thinking to myself, why? Why do these robots have to look like us? Why do they have to have heads and bodies and 2 arms and 2 legs? Why can't we make them more, reliable? Like, for instance, could they have long snouts where they could smell if a fire's coming, like a dog? Or could they have 8 arms? Do they even have to have a head? And can they have wheels and maybe 4 or 5 legs? It's like I don't really know why they're doing this, where they're trying to make these robots look like us. They don't actually have to. They're supposed to help us. So let's make these robots to, be as optimal as possible in helping us humans. And so maybe that leads a little bit, I don't know if that leads into your the mind body integrative work that you're working on. I don't know, but I also think that artificial intelligence can have a great impact, a positive impact, I think, on mental health. But just like you said, and I agree, I think we still have that human bond condition, I guess, to say. I don't know if that's the right word or not, but that's really what we need, and that's really what we have. So trying to artificially produce that, I just don't think will work in the mental health area. Now, telehealth, we are using technology to help with that, and I think you really have some good comments about that. And so I see a future where we have more telehealth, but we still have to have that you're looking at me, I'm looking at you, I'm hearing you with my ears, that I'm responding to you with my body and my mind. So I think our the way we're built as humans, we have to have that. And it doesn't matter what a robot looks like. If it looks like us or it looks like an octopus, a robot's not going to do that. So, so
absolutely.
Anyway, go ahead.
No, I think that is a very interesting point about the way that technology is being developed to sort of like be human or, subhuman or human adjacent, and try to like help us feel more comfortable with it. And, if you look all the way back to like Star Wars, you had R2D2 and C3PO, right? And one is like your kind of your classic little robot with wheels that sort of beeps and boops. And the other one is like your robot butler, that is like human and a little neurotic. And so it's like, I think from the beginning of time, since we were sort of inventing these things in a sci-fi space 50 years ago, we've been trying to figure out what kind of robot we want to interact with, right? And even back then. So I think that will continue to be an object of discussion. But, when we're looking at AI right now, how it's being used is often in a chat space. And we've been, comfortable with chat since like AOL and, the last 30 years of the internet. It's almost like moving back to that early internet, talking to someone that maybe we don't know very well or a friend that we know. And we're just typing in our question and something's coming right back up. And when it comes to a lot of our very common standard mental health concerns around anxiety or depression or things like that, then, AI can provide some really useful tools for self-care, responding to a situation. But again, if somebody's in crisis, if we're dealing with like a more severe mood issue or somebody's having suicidal thoughts, that particular bot is probably not going to be the best. They're not going to be able to make the right decision, clinical decision for that person. So yeah, we're still going to have to work that out and find that space. So I think that the way that technology will be most effective is just, again, making these human connections across the miles, utilizing, virtual technology. I think that's just extremely cool. And we'll see that become, potentially even more effective. I don't know that it'll be holograms, but that would be cool. So the piece about mind-body integrative work, this is something that's coming up a lot. And I started to see it before I opened my practice, investigating the market, so to speak. And I was on social media and looking at some of the hashtags, the influencers, the topics that are coming up around mental health. And over the last 3 or 4 years, as COVID started to get people to discuss mental health, and they were doing it in a social media space because that was initially the only way that people could connect. So people are starting to, hold their phones up and, talk about their, personal life. Maybe they're doing a podcast or doing a video. They were wanting to connect with each other. And then at the same time, there was, more and more people who were getting therapy. They're getting it virtually. And this virtual way of communicating, like into your phone, selfie style, or in this manner, in a virtual call, started to just become the way that we do things. And so it's how we talk about most topics. And we're talking about therapy more. And so we're talking about it on social media. We're talking about it on YouTube and these video formats. And it's popularizing the topic to a point where it's almost like everyone is getting therapy, or everyone is, it might seem very easy to assume that everybody has ADHD or thinks that they do. Everyone is using a common language. And as a therapist, who went to school for these things and who, has worked within the DSM-5, the big giant, guidebook of diagnoses, I know it's not as simple as watching like a TikTok influencer tell you that you need to cancel all of your toxic boss and your toxic mother-in-law and your toxic, family member or neighbor. That is not, I think when we look at the future, we're not going to be able to cancel everyone. That's actually just not sustainable. So I think what we're doing is we're kind of identifying where, like, hey, some of these behaviors that we tolerated from people in the past, they're not great. Let's not do that. But we're hearing this pop psychology language come up so frequently that it's like people come into a doctor's office or a therapist's office and they often like think they know. They sort of diagnose themselves through a combination of like Google searching and social media, videos. And it doesn't really give them a good understanding of their clinical situation. Not to say that we shouldn't decentralize, democratize knowledge. We absolutely should. But we also need to realize where somebody needs to be a specialist, right? Like, I don't want to go to turn in my taxes at the end of the year to someone who is an accountant on TikTok, right? I want that person to be an accountant in real life, not just like have fast facts about money, I want this person to be the one, right? Like if I need to have a hip replaced, I want it to be an orthopedic surgeon. I don't want it to be someone who does that on YouTube. And so we still are always going to need our service providers and our specialists. We're always going to need those people. And I think it's like really wonderful to get this information out there. But I think that to a degree, what's happened is that when we talk about mental health in the way that we talk about it, we actually can victimize ourselves. We end up talking about everything as if we're being attacked. People are attacking me. My boss is not being kind to me. And we're sort of asking for this like perfect 71-degree environment in which no one ever says anything offensive to me. No one is ever toxic. No one ever does anything that is offensive. And what we do is actually we diminish our own internal resilience. Human beings are extremely resilient. That's one of our best qualities. We can be in really, really harsh situations. We can be in war zones. We can be in very, very intense, workplace environments. I mean, it is unbelievable. I worked on Fort Riley for 9 years and heard stories from soldiers and family members for 9 years in the mental health department there. I am fully and deeply convinced of the reality of human resilience. And so when we use too much language that sort of like disempowers us by saying we're having to remove everything that is hard from our lives, that actually diminishes our own resilience. It's as if we said, I'm going to get stronger by not working out, right? I'm going to remove all of the weights from my house because they're hard to lift. I don't want to lift them. And so I'm not going to lift them. I'm only going to lift things that are 5 pounds or less. And now my life will be easier. But in fact, my muscles atrophy, my body's less strong, and I'm not as resilient. And that's the exact same thing with our emotions. And so what's really cool about mind-body integrative work, when we're looking at EMDR or other somatic therapies, we are really focused on helping people become more resilient. We're helping people be able to kind of like push through the emotion, push through the state, and come out on the other side, not just with post-traumatic stress disorder, like permanently, but something that is coming up more and more is this concept of post-traumatic growth. That's an empowered state. When I go through something really hard, when I have a grief or a loss or a death or something that happens in my life that's difficult, you hear a lot of people come out on the other side and they say, I'm really proud of who I've become through that. I don't like that happened. I probably wouldn't wish that on myself again or another person, but I'm really, really grateful for what I've learned and who I've become as a result of that thing. That is often post-traumatic growth or even just growth in our lives. We become more resilient, become more strong. We trust ourselves to go through something hard and come out on the other side as a better person and as a stronger person. And I have gone through many of those things in my life. And every time that happens, I'm miserable in the middle. But then on the other side, I think, oh, wow, I can trust myself to go through hard things and survive it and come out on the other side with, a more content and peaceful and grounded perspective. And that is something I would hate to take away from people because of the language that we use and the demands we place on our environments. And so we need to figure out, like, as we move toward the future, we're really going to, I think we're going to get to a place where we can't use this language to the degree that we are. Therapy will be accepted, but we're not going to be able to call everybody that we don't like toxic. We're going to have to tolerate offense if we want our amazing democracy to continue. We're going to have to tolerate when somebody, I don't like what they're doing to me. I'm going to speak up and advocate, but I'm not going to completely kick this person out of my life. I'm going to figure out how to coexist. We're going to have this melting pot in our workplace, in our neighborhood, in our churches and synagogues and mosques. We're going to hold tension. Another thing I want to mention about mind-body integration is that it really is a tool that is becoming more and more utilized in a way that I actually think maybe in the next 5 to 10 years, we're going to start seeing that that format more integrated into a primary care or hospital type setting. So for example, when I was working out on Fort Riley, they've done a really good job of taking their primary care or their, hospital, physical health care and bringing mental health into it. When I look up a patient's record, I can see their mental health history and their physical health history all together. And it really provides a holistic perspective on that patient and what they need. And so I remember just, that's kind of what I grew up in as I was, being developed as a therapist. I had access to all that information. When I started my practice, I was in a mental health only practice. And so when people would come to me or anyone who was sitting inside that clinic was there for a psychological assessment or couples therapy, child therapy, family therapy, something like that. But it was only mental health. And so when I asked that patient about their history, I would have to potentially get a release of information from their doctor, or I would have to sort of patch together this picture of, their experience. You can ask them questions in the intake, you can get some information, but you're really relying on that patient to report everything about their experience. And so this is never going to be perfect, but I'm really expecting to see more integrative wellness centers, more mental health integrated into the hospital setting. So if there's an ER, there's, therapists on hand to see and assess, the patients that come in and provide that kind of care in the same way that we would do if they have a broken leg or they're dealing with some kind of an infection. There's often a mental health component to so many of the different diagnoses that we see that have a physical health element. Often doctors are confounded by physical health symptoms that have a mental health or repressed emotion origin. And so when we're helping people, with mind-body work, we're really acknowledging that our head is attached to our body. That when we have an emotion, we feel it. I always would say to the folks on Fort Riley, to my patients there, and say, it's called a feeling because you feel it. Where do you feel it? You feel it in your body, and it's like you can tell me where your anger is. You can tell me where anxiety is. You can tell me where depression is, and it's in the body. It shows up in the body. And so depression has a huge inflammatory impact in the body. So when we're looking at, maybe joint pain or other types of, distress in the body that's inflammation based, there's kind of this feedback loop with depression and inflammation. And of course, with a lot of other systems that are affected. Anxiety has a ton of impact on skin health, on GI tract, on a lot of other different systems within the body that we notice. And so then that's just honestly just getting started. The endocrine system is very much disrupted by stress and anxiety. And I'm saying that as a therapist who's seeing clients, experiencing stress and coming to me for anxiety or things like that, but they're also having these coexisting physical health issues. And so it's like, which one do you treat? How does this work? Where do you start? And if you don't have other doctors on hand to collaborate with and work with, then you're kind of feel like as a provider, you're out there on an island. And so I really do think we're going to start to see, mental health integrated into the model in a more holistic way. I'm not sure exactly how it will go first, right? So our clinic that I'm a part of, the Healing House, it has chiropractic, acupuncture, dry needling, nutrition, and some other forms of alternative wellness. And so I'm the mental health provider in that clinic. And so they started as, chiropractic and then have added in these other treatment modalities and disciplines. So I'm wondering, are we going to start with like a mental health clinic that, starts integrating other, disciplines, or will it be, kind of primary care and things like that, bringing mental health in? That's my guess. People are still more likely to see a primary care doctor before they would see, a therapist. And so if that therapist is on site, they could potentially get that treatment that they need right away. So I'm not sure exactly how it's going to go, but really I do think this is going to be the next frontier of wellness in the next 5 to 10 years. And I think a lot of people are seeing that. And kind of seeing the writing on the wall and trying to figure out how to do the integrative model. So yeah, those would be some of my kind of key predictions for the future in terms of like technology and some of the kind of arrangements of how mental health will play a factor in the future.
Great predictions. I want to bring up one more thing. You mentioned resilience, and just talking about some of the language that we use, kind of almost like uh, that we've adopted this victimization language, and maybe I'm not hearing you right, but I think that's what you were saying, that we need to kind of get away from this victimization language and just thought process. Um, I'm wondering, there's an argument out there that mental health isn't so much about the therapist working themselves out of a job, as in trying to actually help people so they don't have to come back. The argument is, let's see what we can do to keep them coming back and giving us money. So,
Oh yeah.
do you see that?
Yeah.
Is that argument wrong? And whether it's right or wrong, what's the future of that?
Oh man. Okay. So, I mean, with any type of service, there is a sense of how do I keep my clients connected to me? How do I continue to serve my clients? And if you're a primary care provider, I've been seeing my primary care doctor for, I don't know, 15 years or something like that. But I don't see her all the time. I see her kind of as needed. She's the person that I go see when I have an issue. And then I have some kind of recurring things that I, see her for. And so I think that if we start to move towards this mind body integration, mental health would probably be treated in a similar way, right? We wouldn't wait until we're in crisis, until our marriage is going down the tubes, until we're having all these physical symptoms and we go, fine, I guess I'll see a therapist, right? We will see that therapist sooner and we'll be able to do a little bit of preventative work. We can start to, release repressed emotions from different things. Like if someone gets into a car accident or they, get mugged on the street or there's something that happens and they can't, do their normal fight flight response, that emotion or that feeling of like, I need to run away or I need to fight back actually gets stuck in the body. And so there's like a little kind of clip of footage in their brain that plays that traumatic thing over and over and over and over again. And so what we're trying to do is help people integrate that story, like plug that story back into the main storyline of their life and get that emotion or that physical action that they needed to take in the moment. We need to help them move that action through their body and kind of get unstuck. And so that I think is something that can be really empowering and create some resilience, but it's not something that we see on an ongoing basis. I think the old model of therapy that was like a little bit post Freud, where everything was getting pathologized, normal human behavior, we were like calling it things, right? Like when somebody's spouse dies, we call it bereavement, which is good. But then we started, using terms like adjustment disorder. It's like, well, I just moved to a new city and I started a new job. And it's like, and I'm having a hard time adjusting. And we're like, well, what do we call that? Because we have to bill insurance for this session. Adjustment disorder, right? Well, so now I just made a diagnosis for something that's super normal, right? And so not everything is, majorly clinical. There's kind of like adjustment to a new baby, but then there's postpartum anxiety and depression, which is, more significant. So we don't want to label everything. And when we label everything and make it really big and scary and like, oh, you have this thing, you have adjustment disorder. And then everyone's like, oh, I have a diagnosis, that can kind of create this dependence on the therapist because the language is so mysterious. And so I guess I just need to go on forever. The newer model, I really do think, is going to be, again, more based on resilience, more based on helping people resolve and integrate their past. And then it's like, you know what? You're going to feel better. You're going to have some tools to use in your everyday life. And then when something happens, like let's say that your kids go off to college and you start a new job and you move or something big stuff happens and you're like thrown off, right? You're like, okay, I have some tools. They're not working as well. I'm going to go back to my therapist. I'm going to work on that for a while and then I'm going to go back out. And so that's really the way that I've tried to treat it. I loved graduating people. It was like, hey, you came in here to work on this and look at you. You're doing an incredible job. Let's see if, how do you do if you're coming in once a month, once every couple of months? because I don't want to pathologize someone's normal life. I want to focus on resilience, and I want people to, I would always say, you're your own therapist 167 hours in the week, right? 160 hours in the week. I'm with you 1 hour. You're with yourself 167 hours. If you don't have the tools to help yourself, then I'm not doing my job, right? And so that was really the thing, that it's not only up to me, but I want to give that person a toolkit that they can use in their lives, for their workplace, for their community, their neighborhood, their family, just when things are difficult. And so I really do think that mental health as a profession isn't going to be able to withstand a model where people have to come back all the time, or they're being disempowered, or their whole experience is being pathologized. I think resilient humanity is where we need to go. I think that everything in our world right now is very tense and kind of scary. Everything from like the political climate, finances, climate change, everything that feels scary. If we don't figure out how to be resilient in the face of those things, then we are going to be like panicked and scared all the time. So resilience is the only option, and healthcare that helps to build resilience, I think, is absolutely the direction that we're going.
Well, Sarah, thanks so much for being a guest on the I Told You So podcast. I really enjoy your thoughts about the future of healthcare and health and mental health care, and how those can be combined and more like partners in the future. And I really appreciate your thoughts about resiliency for people and helping people to be more resilient. And I think your predictions, if your predictions are right about this, and the mental health profession and therapy does go this way and is more resilient in helping people be more resilient, I think that's a bright future for mental health care. So if listeners would like to learn more about Sarah Siders, you can send an email message to her. It's Sarah, SARAH, at Sarah Siders, SARAHSIDERS.com, or find her on Instagram. That's Sarah Siders, and just it's all one word, Sarah Siders on Instagram. So now, because this podcast is about predicting the future, my questions to those listening are: what mental health trends that exist now will continue, and which ones will be corrected or balanced? Another question: what are your thoughts on integrating mental and physical wellness? And I guess a benefit or a disservice to health, what would that be? Or what would those be? And how could you, or how could we, I guess, make that trend a net positive? So let me know. Text or call me at 1-785-473-3721. That's 1-785-473-3721. Or send an email message to me at ITYS at BenKohlITYS.com. That's ITYS, and that's my name, ITYS, BenKohlITYS.com. Or send an email, send a social media post on any of my social media channels. So if there's another podcast platform you prefer, let me know that too. So go to the I Told You So website at BenKohlITYS.com, and you can connect there, or you can get merchandise there. We just simply go to the merchandise link, choose some shirts, hoodies, hats, coffee mugs, and lots of other items. The I Told You So podcast is, at least I hope, a space for healthy discourse and effective debate with the goal of predicting the future, so you, as listeners, and even our guests, can say, I told you so. So also, if your business or organization is interested in advertising on the I Told You So podcast, so you can let me know that too. So thanks for tuning in to the I Told You So podcast, and thanks again to my guest, Sarah Siders. Followers of the podcast are very important, so please follow, like, subscribe, leave a comment, give a high rating, and share with your friends. I'm your host, Dr. Ben Kohl, and I hope to hear from you soon.